Well, hello. This is Nick Fogelson from Northwest Endometriosis and Pelvic Surgery on the Endometriosis podcast, and I am so excited to have Brittany Brown, U.S. Olympian and endometriosis patient and patient of our practice as well. Brittany, thank you so much for coming on the podcast. It's just, I mean, obviously there's a lot of demands on your time and you're on all kinds of things, so I appreciate you being on our little show here.
Of course. I mean, I know you're in high demand too as well, but thank you for having me, and I'm excited for this conversation.
Yeah, so to the audience, I've gotten a lot of questions that I asked people kind of what kind of questions they had for you. So I have some general questions that we ask all our patients when we do these kind of things, but there'll be some specific to you.
Okay.
But tell me a little bit about your story with endometriosis and kind of how it started for you, and then how we got to, getting treatment and so forth.
So I run track. Obviously, that's my job. I went to the University of Iowa and I was running track there, and I started having really bad like period pains. And nothing was really like kind of done. It was more so just push through. It's okay. It's a period. Like I think athletes with pain is very a foreign concept for us because we are in pain a lot of times for our workouts. So I was just told to push through a lot. And then the end of my senior year, or when I was about to leave Iowa, someone had, I was still like having painful periods, heavy periods, and someone had suggested, hey, you might have this thing called endometriosis. Then I moved to Texas and met a doctor there, and they kind of said, get a hysterectomy or have a baby. And I'm like, I'm in the prime of my life right now. Like, I don't want to, have a baby. And I also don't want to have a hysterectomy. Like,
It's
like I'm
such crazy advice, in particular
crazy.
for what you're doing with your life. I mean, obviously having
Yes.
a baby is like saying, well, end your career right now, probably, or certainly
Well,
certainly curtail it.
definitely, I would say not end it because a lot of female athletes are having kids and coming back. But it's something that people like they have the autonomy and the choice, not just, oh, well, have baby to help with endo and knowing that that's not the solution for it. So yeah, I didn't do that, obviously. Then met another doctor, a fertility specialist in where was I? In Texas, and we talked about AMH a lot, which I've also mentioned to you. And she was the one that did an ultrasound and identified the endometrioma, which we also did as well, and talked about my AMH levels and basically said like based off this imaging, um you have endo and also based off your AMH levels, like how they're declining for someone your age. So,
Yeah, and for the audience, so endometrioma, which Brittany mentioned that she had, is kind of a tumor of endometriosis on an ovary. It's kind of like a big pocket of endometriosis.
mhm.
And when you see that on ultrasound, you're almost always going to see other endometriosis. It's not just there, it's usually in other places. And then the AMH is a marker of kind of ovarian reserve, ovarian function. And so as that starts to lower, it means you have fewer eggs, maybe a little bit more difficult to getting pregnant. Now, Brittany, you're in the specific circumstance of being an elite athlete, and classically, really, really highly trained athletes sometimes have something called functional hypothalamic amenorrhea, where you don't actually have regular periods because the body has kind of evolved to say, well, we're starving, when there's not enough food around because you're burning all your food by working out so much. And sometimes you just don't ovulate, and your AMH can naturally be kind of low as well from that sometimes. And so I wonder if that was part of it. Did your fertility physician talk about that at all?
No, only because I was having a lot of periods. So they suspected I was ovulating, but like a very short window. That's what she suspected at the time. But I would have a lot of periods. I wasn't like I was, a lot of people, I don't know if you heard the term called reds, where you kind of miss your period. That's kind of
Mhm.
the amenorrhea. But no, I was having a lot of periods and they were pretty heavy. So I would start to have like probably I was around like a 30 now, so probably around like 28, 27, I would start to have like multiple periods a month. So I'd be bleeding constantly. Well, not constantly, but it felt like constantly to me, and like, uh, um,
So this was really almost 10 years into you starting to have endometriosis symptoms, because you mentioned that they started when
in
you were
college.
when you were in college.
They started in college, and I feel like they started to ramp. up more as I got closer to the Olympics, and like it just started to get and it started to be more like off my period as well. So I'd just be like, dang, like I'm not even on my period. I'm still having like nausea. And the week before my period, like it's like hell. Like, so I'm just like, like it was just, and I started having more regular periods. So it's just like, like it's crazy. So,
How did it affect your running? Like how did you have times where you were running slower or not able to run because of this?
um, I don't know how to like really answer that because I think as an athlete, like, I like to think that it doesn't affect me. And I like to play mind games with myself. Was I running slower? I wouldn't say I was running slower, but were there at times at meets where my period would show up? Yes. And did it impact me? Yes. So the athlete mind in me will say, no, it doesn't impact me. No. But the actual reality of me, yes, it did impact me, impact my training, it impact like I was having to get multiple iron infusions and impact my fatigue. Like endo is a inflammatory and like my job is very stressful. So stress causes inflammation. Then I have inflammation from the endo. So it's like I'm being hit with inflammation all over.
And it can
Um,
go in two directions. Sometimes people who have endo actually have fewer symptoms if they're really athletic because you get the endorphin rush from athletics and so forth. And I've had one patient who had really, really bad endometriosis, worse than yours, to be honest. And she was a really competitive tennis player, not quite on the top level, but she was a professional tennis player. And she actually surprisingly had very little symptoms. And I always kind of wondered, well, is it because she's so athletic all the time? But now we have you who is also, obviously incredibly athletic, but having a lot more symptoms. Um, and some of it may come down to genetics as well. As you may know, African Americans have more. I was just in Kenya, and some of the endometriosis I saw in Kenya was like so bad. I mean, it was horrible. And the doctors there said that, oh yeah, the endo they have in their patients is just through the roof. And
Mhm.
so that may be part of it for you, some genetic predisposition.
Yeah, I think I don't know. Like, I'm not sure, like, if it's genetics or, I think pain just shows up so differently and like how we register pain shows up so much differently. I think I was able to push through a lot. So I'm like grateful for that. But I was also getting to the point where I was like, I'm like tired of pushing through and I don't want to keep pushing through.
Did your
Um,
mom have endo?
no, no, she didn't have endo. We had a history of like family, like heavy periods. I also think a lot of people, like, and a lot of women, just especially older women, they're just like, oh, it's our family, heavy periods or whatnot. So like investigating, no, I think that happens a lot in a lot of different communities, especially women, especially Black women. Like, pain is just something we are genetic like not genetically but we can push through um yeah, I think I was able to push through a lot, but I would to answer that question, yes, I think it did affect me. And by the time we got to Paris Olympics in 2024, went great, got the bronze, it was great. But I was just thinking, I was like, I'm about to turn 30 and, at that time I was 28 and I was like, I just want to like try to give my body a fighting chance. Just show up to the line more healthy. And that's what I've always been like really championing on these past couple years, like showing up to the line healthy, like really trying to show up and push through the line and be healthy. So I made the Paris was in August. I called you in November. And then before that, I had met with some other doctors at the time, and they were kind of alluding to the fact that it was time for me to do something. My endometrioma had gotten bigger. It wasn't that big, but it had grown. So they were kind of saying, and they obviously said what you said, like endometrioma is just the tip of the iceberg. Usually there's more, and there was more in my case. So yeah, I was just like, it's time. So I called you in about November. And luckily, like I was calling around asking to multiple people because I wanted to get it done like as soon as possible. As soon as I made my mind, I was like, I want to get it done as soon as possible. So it's kind of hard. I think a lot of women can relate, like trying to find someone who can get it in your time frame and when and how, because it is hard. And then also all mostly like the high level specialists are booked up. So it's very, very hard. And I've called a couple people, and a lot of them are booked up for quite some time, which is like not bad.
Yeah,
But
we're usually out 2 or 3 months or so, but I'm
yeah,
happy.
yeah,
I'm
yeah. We
happy
just
you gave us.
yes, yes, yes. So yeah, I called you in November. So that's like a month. And then
Well,
we had
I think we tried to get you in on the VIP special, get you in as
you
soon as possible.
you can't say that. And I appreciate all the little like, because I did, when I called you, I was very like, I want the surgery to go as smooth as possible. I'm trying to go right back into season after this. Like, and I want to go as pristine and clean as possible because like, it's hard, like, when I talk about endo, it's like, it's nice, but it's like my body is my job. So sometimes, like, when I have athletes that reach out to me who have endo, like, I can immediately relate to them. But like other people, like, I relate to them. And their job is like, they want to be well in their body as well. But like, I physically have to be well to do my job. And the other women do too as well. I wouldn't not say that. However, like, I have to be well. So when I called you, I was definitely on the lines of I want to, make this as clean as possible and make this as fast as possible, with it still being efficient. And you're able to squeeze me in, which was nice. Because I was trying to compete in 2025. So yeah, I got the surgery 2 days before Christmas. And after that, that was a whirlwind
What
of
what
experience.
was recovery like for you? I mean, you have a lot of recovery resources. Obviously, you have trainers and stuff that are just at your beck and call to help you recover. But what was that like for you?
It was, and I was like looking at some of the questions I got on Instagram on your site and people that DM me. That's like I need to like make my own little thing about that. But and people who aren't even professional athletes, women who are actually just live an active lifestyle, like they really just want to genuinely know, like, like what was it like and how did you manage it? What I would say to a lot of women, like my surgeon, you were pretty blunt with me, and which I loved. Like you were very straightforward that you're not gonna feel good, probably like yourself, until like 6, 7, 8 months. So I was like, you
Kind of
were
worst case
fine.
scenario, but sometimes it can take a while.
And sometimes it could take a while. And like, like myself on the track, like normal on the track. So I appreciated that because I think sometimes you can see online, like, oh yeah, you can go back to work in 2 weeks and everything's fine. And and it's just like,
I
that's
think of
not
it like an injury.
yes.
I mean, you as an athlete, I'm sure you've twisted an ankle or something. Like
Oh,
if you ever, I think of it kind of like a moderate injury. It's like a really bad ankle sprain. Like, okay,
mhm,
right, the day of surgery is a shock. The next day hurts a lot because now you're getting swelling and inflammation, and the next couple you have pain medication, of course. And so
mhm.
that kind of peaks at 2, 3 days, and then but 2 to 3 weeks after surgery, okay, you've recovered a lot. But like if you have a really bad ankle sprain, 2 to 3 weeks, you still know that you did it. Like it's
Yeah.
not like it's completely behind you. And even 3 months later, you may occasionally have a little twinge where you go like, "Oh yeah, I remember." It reminds you that you had that injury. So, I tell patients that yeah, 2 to 3 weeks out, they should be, maybe 90% recovered. But it's going to be months before you barely remember that you had surgery because there's
Yes.
always
Yes.
something that pops up. And
Yes.
and I also people ask about activity after surgery. And what's interesting is the science says that the sooner you can get back to take activity, the better. Like we don't restrict people after surgery because there's just no science behind telling people to not do X or Y. And even heavy lifting, some people say, well, don't lift anything heavy for a while, but there's no science behind that at all. In fact, there's been some studies showing that just getting up out of a seated position is more stress on your incisions than lifting stuff that people would tell you not to lift.
Mhm.
So, I think I told you just once get back to whatever you're comfortable with. And, my one of my associates, Jeff Watkins, is a general surgeon. He has patients just be as active as they want, as soon as they want. And I think that's what we pretty much told you too. And that
Yeah.
your own trainers and stuff are going to be able to tell you like when you're ready.
Yes, yes. And that like I had like a team. I had my PT, I had my pelvic floor therapist, I had my coach, like everyone was on plan and like since my training is the intensity is so high, like we really had to like measure it and taper it because you can't just go full on and be like, here we go. Like I'm sprinting is a very hard, intense sport. So we really had like it's a good team and we try to do like a lot of my PT, my pelvic floor therapist, like They kind of said like we tried to do some research in that like recovery and like training after like high intense sport after the surgery, and there really wasn't much research. And I'm like, well, there's not a lot of athletes, professional athletes that get the surgery and go back into training. So we kind of just winged it. We kind of just came up with our own plan. So it worked out pretty well. So, but yeah, it was it was like like my PT is coming from a background of like hamstring tear, hamstring injury. This is step one. This is week one. This is week two. There wasn't really any of that.
Yeah.
So we had to do our week one, our week two, our week three, and we slowly and gradually, based off how I was feeling, what I was feeling. So that was like a little like science experiment we were doing on myself. So that was interesting, but the recovery was, I think the fatigue was probably the hardest part for me. Like I didn't realize like how like fatiguing it could be.
Yeah, just healing. When you heal, the incisions and stuff just take a lot of energy out of you. And I tell patients, who have like big surgeries like bowel sections and stuff, that it just takes a lot of sort of your mana or your energy to directing towards healing your body, and that takes away from the rest of the energy you have.
Yes. So at the same time, I was healing and also trying to practice. So it was I think I look back on it, probably confusing for my body because like, it's like 2 months post-op and I'm trying to run and my body's like, and I am running, but my body's like, okay, we're still like
This
healing.
was the end of 24, right? December 24.
So I had the surgery December 24. I
Yeah.
got back on the track officially the last week of January. I had my first race, April, I believe. I had it like 4 months post-op. Now I would never do that. Whoever's watching this, please don't do that because it was
Okay.
way too fast. And I look back on it now, like
Did you win?
no, I did not. I did not win. I That was the first couple races back was like really hard for me. Like I did not feel like myself. Like I was running like really not good times for myself at all. Like I did not feel like myself like at all. I really started feeling like myself like 7, 8 months post-op, but yeah, the first races back, I just did not feel like myself. But like as we said before, like it takes a lot of your body to heal, like where the endo was, like the muscles and all that stuff. Like we talked about it before, like one of the places it was like my uterosacral ligament, and like that's not like it connects to other parts of muscles. So it's like having like I talked to someone after and she
When
was a nurse and she kind of said like it kind of made sense when she talked to me. She was like, your body's healing, but it's also like trying to remember how to activate these certain muscles and trying to like also like some of these places in your body were so activated, so now the endo's gone. So it's like playing this balance game of like places that don't need to be activated and trying to activate and work certain muscles again. So
yeah,
that was like when she said that, it really just like clicked. I was like, oh, like my body's kind of relearning how to
I think
do this.
that's right. You have your pelvic floor muscles often get very tight with endometriosis because that, especially the sacral nerve roots are activated, so you're getting some contraction in the pelvic floor. And so you're not running with those things per se, but the pelvic floor is contiguous with all your abdominal wall muscles and your back muscles. The body, if you ever see a animal or something, it's all one big block of muscle. Like in the anatomy book, you'll see these different muscles, but the reality is it's one big sheet of muscle across the whole body almost that's broken into different little chunks that we call different things, but it's all kind of stuck together. And so, if your pelvic floor is tight, that's going to make your abdominal wall tight. It's going to make your psoas muscles tight, which of course is a big part of walk, big part of running.
Yes.
Um, your glutes, if your sciatic nerve is irritated, that's going to affect your glutes. It's a big part of running. So, it all goes together. And so it's going to take time. And, I think I even told you, like, I don't know. I mean, you're the first ab elite athlete I've ever done surgery for. So how are you going to do? I don't know. I mean, I'm going to remove you. I promise I'll do a really good job removing the endometriosis, and then we're going to see how things go. And, it's hard to say exactly how soon you'll get back. So, I learned something from you, just kind of some experience that if we're in the situation again, we'll say, well, this other person had these issues. Um,
Yes.
how did
Yeah.
how did it affect your endometriosis symptoms? Like, what was the sort of timeline where you started to notice a difference there?
Um, I don't know. I feel like around like month 5 or Maybe. I don't know. I would say I don't know what month, but I started like I think I told you before, like it used to hurt to poop. Um on my period on my period. Now it does not. Um my periods, like the first month or two, I think I'd share with you, like a little wonky, kind of longer. But now my periods are very, very lighter. So day one, two, still a little heavy, but like I would have periods that would be like 7, 8 days long. I would have multiple periods a month. I would know when I'm starting my period. So like that's something that's like also like different for me now. Like I couldn't even tell you when I'm like I track, but I don't have the symptoms of I'm about to start my period. Like
Hmm.
when I was about to start my period before surgery,
Because a
I
lot of
would,
inflammation
oh
with
my
endo, you're getting a lot of inflammation coming up into your menses.
Oh my God, I would know immediately. Like it would almost be to the point where like, especially while I was running, like I would rather be on my period than about to be starting my period because like the about to be starting was more painful or more like I would just really like I would be so tired and so drained versus now like I don't really feel that. Like I couldn't, I'm like, dang, like here's my period. So like even though I'm like still tracking, but I don't have the symptoms of it. Um, so
Are you
that's
on any kind of suppression now, like birth control pills or
I'm
progesterone or
not.
anything?
I'm currently not. But yeah, I just yeah, I'm not on that. But yeah, I not really like the headaches, the nausea is not there anymore. What else? I don't have to get multiple iron infusions within a year, so that's also nice.
Did you run and I can have a curious question specific to you. Like, did you run into any issues with the anti-doping regulations and sort of your surgical recovery on things that were not allowed or allowed?
No, I did not.
No, because I mean, we give narcotics and anti-inflammatories and stuff. I don't think there's
No,
anything
no.
that's not allowed. This
Nothing,
is
yeah, everything was fine. I think, yeah, I mean, and some people have different issues going into surgeries and whatnot, but like I didn't have anything that was like super major for me. Um, but no, I didn't have any like I literally just only took I'm not a big fan of what's it? I'm love ibuprofen, but there's another drug that would I'm just that always makes me feel nauseous. But
yeah, like oxycodone and so forth.
yes, yes, I do not like taking that at all. Like, it does not. Some people love it, but I'm just not a fan of it.
No, it's
Um,
good to not love it. People that love it have
no.
problems sometimes.
So I'm glad I don't love it. But yeah, I didn't have any problems with that. But yeah, the recovery was like it was hard. Like I think for me as an athlete, my expectation for myself, I think I told you my first couple races were not good. My expectation of myself was up here, but I also had to realize like I'm 4 months post-op. I'm trying to do intense sprinting. So I had to kind of lower my expectation a little and be realistic about it. And it probably wasn't until like month 6, 7, I was like kind of just like I think someone asked me a question about like the emotional mental side of it. And I was like, yeah, it was hard. Like it was hard like emotionally because like I had, like my expectations were so high and I had to come to the reality of like, that's just not where my body is right now. I had to be very, very accepting of where I was at that time in my life. So that was hard. And also just dealing with I think a lot of women sometimes deal with guilt of just like, I don't know, like I was living in pain for this long, like, and then after the surgery, you realize all this stuff. You're just like, dang, I had talked to this doctor and that doctor, and no one really listened to me. So it's like,
How many doctors did you talk to before endometriosis got brought up?
um, probably before the word got brought up, three. Before someone tried to get me to have a surgery, probably like six. So
You
yeah,
know, a
it
lot
was
of
a
people just get blown off, I mean, people
yeah,
there's sort of this expectation that painful periods are normal and a
yeah,
certain small amount of pain, take some ibuprofen and Tylenol is maybe normal-ish, but if people are missing work or missing school or interfering with their life or having to build their life around when their menstrual cycle is going to come on, like that's not normal. Like that is endometriosis 98% of the time. And
yes,
and, and the other 2% of the time they missed it.
yeah.
It's like it's really quite common and
Definitely common.
there's so much we can do about it. So I'm glad that you reached out to me. How did it go at the end of the 25? You did well in some events,
I
right?
did, I did. So that it's funny because like a lot of people say my last race it was at Aflos. It was like the all women's track meet, new league kind of coming up. But my last race in October, I won. I won first in both races.
Yay.
So that was
Congratulations.
thank you.
And you
Um,
run the 50 and the 100, right?
yeah, the 100 and the 200.
Oh, okay.
100 and 200. So I won the 100 there and won the 200 there. I still made the US team last year and for Tokyo, but I just didn't do good well. I didn't do well there. But I PR'd at my last meet. So that means like personal record for people who
Yeah,
are
that's awesome.
um and a lot of people were asking like, "Oh, how'd she PR at the end of her season?" And I was like telling them, I was like, "Well, I had a surgery this year." So they're like, "Oh, like so." It was kind of like full circle for them to like realize. And some people did know because I had been talking about it pretty openly on my Instagram and some other places. But um, people were able to piece together like, "Oh, like it makes sense. You just had a surgery." And like for me, like my season kind of didn't really start until like in my or me feeling normal, probably like I don't even know, like July. So it makes sense that I kind of peaked at a different time than everybody else. So, but it ended well. It did end well.
So tell me about where you're at with, I know that you've been doing some advocacy work. I've seen you in a few just different publications on endometriosis. Like, how do you feel about that, and what are your plans with that?
I don't, I feel good. I like it. It's like a different realm for me. I feel like no matter what I would have done, like I'm not like a huge public figure, but I am a public figure. So as soon as I speak about something, like it will become a topic. And I remember the first time I ever talked about it was in 2023 when someone asked me about painful periods. And at that time, I just had that conversation with the fertility specialist like 2 months ago, and I started talking about it. And the interview kind of like went viral, and I kind of said I had endometriosis. So it's like like it's a different like realm, being its advocacy realm. Um, and I think there's so much I could do with it. There's also so much I can't do with it because of my job and what I do. So there's only so much I can do, but I'm definitely like in the space of like sharing my story. The different perspective of being an athlete and having this has been like a huge, like I think in sharing, there's been multiple athletes who've reached out to me who have wanted to get the surgery and who are just afraid, just not sure like what the recovery is going to be like. It's just like I want to do it, but I just don't know what the recovery is going to be like, and I don't know how my body's going to react. And like, most of us, we athletes, like we know PT, we know like if we get injured, we go to PT. But it's like, what about if I have this surgery? Like, no one who's going to help me with that. So it's like there's not a lot of people out there
Yeah,
that.
you can be a real good resource there because like I said, like I wasn't really entirely sure. So I mean, it's good to have people with that experience. So I hope that you can be a resource to people, and I have some
Yeah.
knowledge of your course that I can tell people about.
Yeah, yeah. So it's been interesting trying to figure out like what I want to do in this realm. Like there's so much I could do. So I'm like just kind of figuring it out right now. I'm still sharing, I'm still providing resources. I'll get on a call, especially with a lot of athletes. I've gotten on calls with athletes and just who have reached out to me and just, hey, I want to talk to you. So in the smaller, minute ways, I feel like I'm the advocacy work. But there's also like bigger ways. I'm just trying to figure out what that would look like for me. But it's been very interesting sharing and also providing resources to people like, hey, follow this person, reach out to this person. Like if I can just be like a vessel, I think that also is like really vital for me as well right now as I'm still in my career. So yeah, it's been interesting in the advocacy world as well. And I like it. It's different. And it's like there's so much that you can do.
You, I have some patients who really dig into advocacy and some that don't want to do anything at all. And I think it's all fine. I always tell patients like, you don't owe the world anything.
You know,
this is your own experience.
you know.
And if trying to get the word out, some people feel like they've been ignored for a long time and feel very kind of energized. Like once they get information they didn't have before and they got better, whereas they weren't getting better before, like they want to go shout it from the rooftops and tell everybody about it. And sometimes that lasts for a few years and then they kind of peter out. And
Yeah.
occasionally people do it for get really into it and do it for a long time, and other people don't do it at all. And any one of those courses is fine. Like,
Fine.
it's your own path. You don't have
Yeah.
nobody has to go and try to educate the world if they don't want to. It's fine.
No. Yeah, I think and like that's like important to say because I feel like some people like feel like you just have to say something. It's like it's hard because like endo is full body, so there's also and there's a lot of comorbidities with endo. There's a lot of stuff people who find out after they get the surgery, they have this and that. That's the phase I'm in my life right now. But yeah, I feel like there are times to, like I said, I can't do it. I'm not gonna be on the White House doing something right now. It's just I'm training right now for my job. But if I can have a 30-minute call with a girl about like, what she wants to do, her options, like I can do that. So like and it's also hard because like if you have endo, like you're living with the chronic inflammatory disease. So it's like you're also being an advocate and also dealing with this. So it's like some people can can balance it well, and some people can't, like, because it's like your body is like, being like ripped apart at times. So yeah, I always tell people like you do what you can. If you don't want to do anything, don't say anything. Like, because it's already hard enough living with endo. So
Yeah.
like, being an advocate is work. It is work. Being an advocate is work. And it's also very vulnerable. Like if you don't feel comfortable being vulnerable, then like maybe this isn't the best thing for you.
Yeah,
So
and people can do whatever they want. Again, I think it's awesome when people do, and it's awesome when they just live for themselves and take care of themselves. And if that's not for them, that's totally fine. I was just in Africa and I met a woman named Artie Shaw, who she's like the one of the most prominent advocates in Africa. She lives in Nairobi, and
hmm.
what a delightful woman. I was like, she was really cool, and I realized, wow, there's this whole advocacy community in Africa, so it's everywhere.
It is everywhere. It really is. It really is. People are just we're looking for better testing, looking for an answer of why, when, how, looking like like a lot of people are just looking for better answers with this and it still hasn't came up yet, but yeah.
Well, Brittany, is there anything else that you would like to tell our listeners about your story or anything else that you can think of?
No, nothing I can think of. Nothing else. Like,
Okay.
yeah, nothing
Well,
else.
thanks so much for talking to us. I'm sure that people will be really interested in the conversation, and we'll
Oh,
throw
I had a question for you.
absolutely.
Have you heard of any new research? Like any any for diagnostic testing besides like surgery and like any new step closer to finding out why?
So there's a lot. First of all, there's a lot of endometriosis research going on out there, and I think some people say like, "Oh, it's not being researched." I'm like, actually, there's a lot of research going on. It's because it is so common. It's a potential source of significant, profit for companies. I mean, if they can figure out something really effective, it's going to be a really big gangbuster drug. So there's a lot of companies out there that are doing things. There's NIH funding as well.
Mhm.
Um, but so there are non-invasive tests, some of which are genetically based that are not that good yet. There is a test for looking at the lining of the uterus where you look for IL-6 that's pretty accurate. And then if it's negative, you almost certainly don't have endometriosis. And if
Okay.
positive, you often do. So that's a test that's on the market now. We use that mostly in infertility. We usually don't use it in pain because pain patients usually need a scope anyway.
Mhm.
But for people that are having infertility that don't have pain, sometimes that's a good test to do. Um, and as far as non-invasive treatment, there's a lot of things that are kind of in early trials or in research. Endometriosis has some angiogenesis or blood vessel development kind of aspects to it, and there's some interest in anti-angiogenic compounds as affecting endometriosis. I think that as we better understand the genetics of why people have endometriosis, and it may not be the same genes for everyone, it may be individual kind of strains, that there may be opportunities to do genetic treatments. And this stuff, it's just moving really fast. And I think the world 20 years from now is going to be dramatically different than it is now. And every 5 or 10 years, we take a huge leap.
Okay.
AI is very interesting in its ability to test things sort of like, Einstein figured out a lot about the universe just doing math on a chalkboard,
Mhm.
and I think AI is going to give us the opportunity to look at a lot of biochemical compounds and kind of almost experiment on them without doing experiments and without sort of a different way of doing science. And so it'll be interesting to see where we get 5, 10, 20 years down the road. And I'm confident that I'll be put out of business sometime in my lifetime, but I'm 50 now. Probably by the time I'm like 65, I'll be like, I've had enough anyway. So I'm probably safe. But if my daughter was going to go into endometriosis surgery, I'd be like, well, maybe you gotta keep your options open.
Yeah, yes, yes. Well, that's cool. I'm glad that you're saying you're confident you'll be out of a job. I mean, I don't want you to be out of a job, but like I'm glad that, you're
At some
confident.
point, people will always need hysterectomies and stuff, but I think endo, it would be great if there was non-invasive treatment. Right now, there's hormonal therapy, which kind of decrease symptoms, but doesn't really decrease the disease state.
Mhm.
But we're in this weird spot where there are some non-invasive tests, but there aren't really any good non-invasive treatments. So, like,
Mhm.
in order for you have to have the things together. Like, for a non-invasive test to be useful, you have to be able to have a non-invasive treatment because
Mhm.
otherwise you're going to have to scope the person anyway. So, they're going to have to go hand in hand. I think that the testing is ahead of the treating, but we'll get there. I mean, science continues to push forward, and it is an area of active interest. Um, believe it or not, the Republicans and Democrats have come together to try to increase endometriosis funding. That Orrin Hatch and what's her name? I can't remember. She ran for president, but she was a former senator or still a senator now.
Mhm.
They got together and wrote a bill for endometriosis funding. So it's one thing that both sides can agree upon that it's useful. So
Mhm.
that's good. They can't agree upon funding the TSA, but they can agree upon endometriosis. So that's good. What else? Anything else, Brittany?
That's not the questions I had. Some people asked some other questions, but yeah. Yeah, yeah.
Well, Brittany, thank you so much for joining us. We're going to put this out in probably a couple months just because we have one other thing coming up first. But it's really awesome. I'm sure that it'll get a lot of interest, and I hope you share it on your stuff, and we'll share it on ours, of course.
Yes, yes.
And I hope you have a great season. What are you going to be running this year?
I'll be running I don't even know. I don't know if I'll do both. Last year we tried to double, it just didn't happen just because I was recovering from surgery. But maybe we'll try to do the 100 and the 200 this year. Have some meets in New York, that I know so far, and then Budapest. That'll be and that's like a big end of the year world championship kind of deal. So I'll be doing that and just, taking care of my body, making sure my endo doesn't grow back, being
Do,
less stressed.
do you come to Eugene at some point, right? I mean, the U.S. track.
We do, but not until 2028. So for 2026 and 2027, they put all the US championships in New York. So 2028, I'll be back on that side.
Nice. For people that don't know, Eugene, Oregon is where I grew up, and that is like one of the homes of track in the United
Yeah.
States. It's where Nike started. And
Yes.
Bill,
I
Bill,
actually was just in Eugene. So
oh, nice.
I was actually in Portland because I was actually gonna tell you I was gonna actually, but I was just in Portland because Nike's there. So the headquarters
Right.
of Nike is in Portland. So I was actually just there.
Awesome. Well, Brittany, thanks so much, and keep in touch.
Thank you.
Okay.
Okay, bye-bye.